Well, good afternoon, everybody. I want to welcome all of you to part two of our Friday seminar series sessions to kick off the academic year. Last week, we had a really robust and engaging session with our colleagues from social and behavioral sciences and epidemiology and biostatistics and health services administration and policy to talk about what those disciplines do and how do you become interested in working with people and so forth. And this week is part two, in that we're really going to focus on the clinical disciplines within the college. Many of you may know, but some may not, that we are actually one of the largest and most diverse colleges of public health in the country with respect to our academic programming. That a lot of the disciplines that are represented today, like nursing and social work and communication sciences and disorders, are not disciplines that are often seen in colleges of public health. And when we were reorganized as a college in 2014, I think bringing all of those disciplines together has added an element of breadth and depth and richness to our community that allows us all to thrive as students, as staff, as faculty members. So I'm really thrilled to have so many representatives from our clinical disciplines today um, joining us. And what I've asked all of them to do is to briefly introduce themselves, take a sentence or two, maybe three, to tell us a little bit about their discipline and what they do and what they specialize in. And then once we've done the introductions, I'm going to moderate some questions for all of them. And hopefully we can have a really robust discussion about how these disciplines work individually and how they coordinate and collaborate with one another. Probably with about 20 minutes to go, we're going to turn things over to you. So if all of you have questions or comments, please put them in the Q&A feature or the chat feature, and then I'll moderate those and direct those on to other people. So I'm going to go across the Hollywood squares or Brady Bunch of Zoom faces, depending on which your favorite analogy is. And we're going to start with Jennifer Brown. So Jen, do you want to introduce yourself to everyone?
Hi, everyone. Hello from nursing. I am Jennifer Brown. I'm an assistant professor in the Department of Nursing within the College of Public Health. I'm a third degree RN. I've spent most of my nursing career in various critical care settings with over 15 years in operational leadership before becoming a nurse. As a nurse educator, I spent most of my earlier years because I was an accelerated nursing student. Most of my time was spent in the accelerated nursing programs. I spent time there as faculty, but also very involved in curriculum design and revision. My passion is really about working with students, developing them, but also working on projects that addresses the needs of the underserved and disenfranchised in our communities and just looking for ways to give back. About my discipline itself, nursing is a profession that, well, within the whole healthcare sector that focus on care of the individuals, families, communities, so that they may attain health, maintain it, or recover optimal health and have the best quality of life. Within the department here at Temple, we are entrusted, or maybe I should say gifted, with the responsibility of preparing competent nurses to acquire and utilize what we refer to as evidence-based clinical knowledge, along with critical thinking and effective communication skills and team collaboration to ensure that they have quality patient care and safety knowledge to first pass the NCLEX and then respond to the nursing demands of the workforce and the healthcare system. So with that, I think I'll shut up for a little bit.
Great, thanks, Jen.
You
And
welcome.
Russ, do you want to go next?
I'd love to. So good afternoon, everybody. I'm Ann Russ. I am an associate professor of instruction in the athletic training program. Here at Temple, we are pretty unique. We have a professional entry-level master's degree for athletic training, and then we also have a doctorate of athletic training to help people enhance their clinical practice. Athletic training, it is unique compared to some other disciplines because we see our patients a lot of times before they become our patients. We're working in high schools, colleges, professional, amateur sports. And so we're trying to prevent injuries from occurring. But once the injury does occur, we're usually one of the first people that that injured athlete gets to see. So we get to do the evaluation, diagnosis, provide the immediate care, work to help that athlete or patient recover and return to their activity. And we'll collaborate with other professions to get this done. And it's interesting to see. We're also doing more with performing arts and some like non-traditional sports like race car driving, and seeing like more people and acknowledging the athletic endeavors that more people are doing.
Great, thanks, Ann. Jonathan Hartman.
Hi, everyone. My name is Jonathan Hartman, and I am the ASL Culture Program Director under Communication Sciences, and I am an instructor. I developed the curriculum for the ASL classes, all 4 levels. We collaborate with other programs in the college, and there are some students that go into interpreting. They might transfer to another school. I work under the communication science program, and something like aphasia, we help students to prepare that if they interact with somebody that has that disorder, that they know how to gesture and to communicate with them. Some people can't access spoken language themselves. And so our program helps to really instruct these people on how to use a visual language.
Great, thanks, Jonathan.
And I'm just so thrilled to be a part of this ASL program. We got started around 2015, 2016, and our numbers have continued to swell. It's been very exciting. And I guess that's about it. Oh, and I look forward to working with other departments in the college and collaborate further, like physical therapy, occupational therapy, and also nursing.
I'm glad you brought that up, Jonathan, because many people in the college do not know that we've had some multidisciplinary clinics that have started to develop in the last couple of years, where many of the disciplines that are on this call have started to come together and provide clinical services and clinical training opportunities for their students. So I hope we have an opportunity to come back and hear from all the disciplines on that perspective. So we have a second member from Communication Sciences and Disorders. So Fel, do you want to go ahead and introduce yourself as well?
Sure. Hi, everyone. My name is Felicia Garcia. I'm an assistant professor of instruction in communication sciences and disorders. I'm really glad that I'm here with Jonathan because it really represents how we have people who are more clinical in our department, more like myself, and then others who are more humanities, right? More like what Jonathan teaches. And I teach in the bachelor's program and the graduate program for students who are earning their master's to become a speech language pathologist. We have a clinic on campus called the Temple University Speech Language and Hearing Clinic, where we offer free services to the community from 0 to 99 with all manner of elective speech therapy or speech and language therapy related to developmental delay or injury. And that's part of our coursework. So we do a lot of different things.
Great, thanks. And Dan Rosny?
Hi, my name is Dan Rosny. I'm happy to be here with everyone. I'm an assistant professor of instruction in health and rehabilitation sciences. I'm primarily responsible for the Department of Strength and Conditioning and Olympic powerlifting courses, as well as performance nutrition. So the primary responsibility of S&C coaches is to develop training programs to boost athletic skills, performance, and biomotor abilities such as strength, power, endurance, agility. So when creating these programs, we consider the athlete's sport and positions on the team, the biomechanical movement patterns, muscle fibers utilized, as well as the bioenergetics that fuel them all. We also work with folks like Ann in athletic training to help athletes achieve peak performance. So for any student out there in our audience who may still be deciding their particular career trajectory, if you enjoy the health and fitness field, you just might want to consider using your passion to inspire and train athletes.
Great, thanks, Dan. And Ann Doloff?
Oh, hello, everybody. Happy Friday afternoon. I'm an instructor with the undergraduate recreational therapy program, and we use recreation as a tool to help specifically people with disabilities really work on their own health and wellness through recreation. It's an exciting thing to do. I'm still I still teach adapted skiing. I've been doing that for 30 years. So if you think about the sport of skiing, you might think of it as just teaching the skills of how to ski, but we work on so many other things. We work on dynamic balance. We work on navigating the etiquette of being in a ski resort. We work on building relationships with others so you can ski with family and friends. So if you kind of take that concept and apply it to the many different things we do for fun and enjoyment, there's so many other reasons why we do them and get benefit for our health and wellness. So in rec therapy, we're looking at working with people to really help them navigate those things they do for fun, or maybe they're not doing anymore and getting back into them so that they can really find that sense of enjoyment and social connectedness and contribute to their overall health. It's exciting.
Great, thanks, Ann. And Sydney Gaffney.
Hi, everyone. My name is Cindy Abbott Gaffney. I'm an associate professor of instruction in the occupational therapy programs here at Temple. The occupational therapy programs currently consist of an entry-level doctorate and a post-professional doctorate. We recently phased out our last cohort of the master's level program. Occupational therapy is a wonderful profession, so I will echo Daniel's sentiment, and if you are undecided, you should check us out. Occupational therapy sees individuals' health and wellness through a unique lens, integrating the physical features, the cognitive features, psychosocial and emotional characteristics and skills of every individual. We try to integrate those with every person's occupations or activities that make you who you are. We do a deep analysis of activities and occupations to really understand what skills every occupation requires and what is necessary to be successful in engaging in those occupations. I worked exclusively in traumatic and acquired brain injury for 20 years of my career, and then branched out into pediatrics because my focus and experience had been clinic-based, hospital-based, and outpatient-based. But then I really started to hone in on community is where life happens for the rest of the lives of the individuals that we work with. So I was even active in school-based practice, focusing on community skills. My passion throughout my entire career has been getting services going in underserved areas and under-resourced areas. I grew up in an area just like that with a family member with a traumatic brain injury. So I lived firsthand what that experience was like, and vowed that if I had the opportunity, I would make it better for everyone else that I could. I teach a variety of courses in our OT program. I think my favorite one, though, and looking at you, Ann Doloff, my future partner, is assistive technology, focusing on adaptive design and assistive tech in the way that those can make people's lives better. And I'm a big proponent of interprofessional education and interprofessional practice. I've never known another way. So when I later in life learned about people who operate in a vacuum, I still don't understand that. So I'm very excited about working with all of the individuals on this program today and talking about how collectively we can make it better.
Thanks, Cindy. And Levon Couch.
Good afternoon, everyone. Thank you for including physical therapy in this discussion. Again, my name is Levon Couch, and I am a physical therapist by trade. and a certified strength and conditioning specialist. So yay that both are on this call. I'm an assistant professor of instruction and the director of clinical education for the Doctor of Physical Therapy program here at the Health and Rehab Sciences Department for the College of Public Health. And we have basically the training for our individuals to be movement specialists. And we provide care to anybody who may have had an injury or an illness or disease. And we help to care for people to maximize the quality of their life. We're there to help them improve their function, their ability to move, their ability to walk and interact with their environment. And we use our hands-on techniques, therapeutic exercises, modalities, and patient training to assist these folks to get back to their prior level of function. The program here at Temple is an entry-level doctorate of physical therapy program. And we also have a pro bono clinic that our students run, which is the North Broad Physical Therapy Center. And our students also do interdisciplinary care at the Lehigh Center, where the community comes and they perform exercise classes as well as physical therapy services. So we do get to work with a lot of the other disciplines that are within the college. My specialty is being a generalist, but my preference is working in home care or in an inpatient setting with the geriatric population and with cardiovascular patients. And with that, in physical therapy, you have different categories. You can be specialists in cardiovascular care, in neuromuscular care, in orthopedic care, sports care, vestibular care, et cetera. And here at Temple, not only do we have the Doctor of Physical Therapy program, we have an orthopedic residency program. So you have lots of options with this particular profession. And I agree, if you're undecided, please explore all of these professions because there's a lot to offer for students. Thank you.
Great, thanks, Lavon. And Monica Taylor?
Yes, hello everyone. My name is Monica Taylor, and I'm excited to be here with you all this afternoon. I'm an associate professor of instruction in health and rehabilitative sciences. I am a clinical exercise physiologist and a certified strength and conditioning coach. So I have worked both clinically in cardiopulmonary rehabilitation and in performance-based settings with athletes and the general population. And when we think about an exercise physiologist, really, they work to analyze our patients' fitness in order to help them improve their health or maintain good health. We also help patients with heart disease and other chronic conditions like diabetes or pulmonary disease to regain their health and get back on their feet. And some exercise physiologists are self-employed, but most others work for hospitals or other healthcare providers. We also work in multidisciplinary settings to help patients improve their overall health and wellness, and working with several of the professions that have already spoken today. So thank you for having me.
Great, thanks, Monica. And last but certainly not least, Ashley Stewart.
Hi, everyone. Thank you so much for having me here. I'm Ashley Stewart, and I am an assistant professor of instruction at the School of Social Work and the MSW program director. So really excited to be here and talk a bit about social work, a profession that I love. My particular area of focus and specialization is institutionalized forms of identity-based oppression. So my areas of expertise are in organizational change practices, equity and racial equity, as well as trauma in the clinical sense. So both the macro and the clinical. So in the School of Social Work, we have a wonderful BSW program as well as a wonderful MSW program. The MSW is considered to be a terminal degree in the field of profession, as well as we also have a dynamic Bachelor's of Social Work program where folks can go immediately directly into the field with a multitude of different career options with a BSW. So we are very excited about what that offers. In the field of social work, we address systemic and structural issues within our society. we look and take an ecological approach to different varying social issues, respond to those, and think critically about how to make more dynamic and inclusive environments. This can include macro practice, where folks are looking at policies, procedures, politics, maybe some entrepreneurial or different types of leadership roles, as well as in a clinical aspect where we have folks who are working within many service and helping profession environments, many of which we've heard of our colleagues doing amazing work in today, as well as doing direct practice with individuals who could be experiencing myriad of mental health, mental wellness, as well as interpersonal experiences within our society. Really excited to be here and to talk more about social work, and also really excited about the interdisciplinary nature of social work, in which we work with the other professions within the College of Public Health.
So Ashley, I want to build on something that you just said, because I think it's interesting, and other members of our panel used different words to describe this. I'm going to see if I can hit this all. So in listening to all of you, it's clear that some of you work in very discrete areas, or with helping individuals develop a new set of skills, rehabilitate a set of skills. But then others of you kind of bring your work to a bigger stage. So Ashley, you talked a little bit about policy. Fel, you and Jonathan, you used the word humanities, which I thought was really interesting, because I wouldn't have been a word that I would have necessarily, I didn't anticipate you saying that. And then Ann Doloff, you used the word etiquette. You talked about how when you take people out on the ski slopes, it's not just teaching them the skill of skiing, but it's the navigating the lodge and kind of fitting into the larger fabric of the situation. So can some of you comment a little bit more about kind of where you fall on that continuum, and or do you really see that the work that you do in your disciplines needs to go from the micro, to use a term Ashley used, that's small and skill focused, all the way up to bigger issues around policy and socialization and so forth?
Yeah, well, I'm unmuted, so I can get us started. One of the things that I particularly love about the approach of social work is it is exactly that ecological perspective. So we recognize, as many of the other professions on the call, that we're really working with people in environment, right? In environments that impact people. So it is a multi-directional relationship. So we might be working with an individual in a clinical or in a micro aspect, but we recognize that systemic and structural issues might be impacting that individual dynamically, right? So with something as big and more like universal concept like transphobia could be absolutely impacting the individual we're working with, but also the different organizations that they're interacting with on a daily basis, the different hospital settings that they're navigating, or whatever that might look like in the community or the context of a broader society. And so that looks like, what does interventions look like at each of those levels to support an individual with wellness, then to begin to impart change in that education system or that healthcare system. And then what does that look like to influence the policies that would impact the way that system is impacted or working with that person, and then of course changing the societal cultural values that ultimately would impact individuals. And so the multi-directionalness of that is really important in the work that we do, and also to me personally the most exciting part about the work that we do, seeing that whole picture.
That's great. Thanks for building off of that. Anne, I saw that your hand popped up.
Yeah, I think all of us practice in such a spectrum of industries and settings and locations. And I think Anne referred to that, like, why wouldn't athletic training be with ballet and in the performance arts? That makes so much sense, yet hadn't really thought about athletic training. I mean, you'd think football. So we all practice across such diverse settings that I think a lot of that comes from wherever we might work, or we might start off, and where we might move to in other jobs that we take over our career. So I think we can go from that micro to that macro as we grow professionally. And I think that's what's really exciting about all of the options we have in the college for students to consider, is you really have a lot of options within all of our majors.
Cindy?
I agree, and dovetailing nicely, all of these professions work so well together: athletic training, PT, rec therapy, social work, to evaluate what's happening in the community, both from a social and access kind of level to issues like cognitive and physical access. So something that occupational therapy, physical therapy, rec therapy often work together on is doing those actual measurements in the community from a physical perspective, for example, ADA compliance. And we collectively are the ones with the expertise to make the recommendations, but then get behind it and advocate to make sure those changes happen. The ADA has some amazing guidelines. The amount at which they are followed is shameful. There's a lot of work to be done. So we're very fortunate to have each other collectively.
Fel?
In speech pathology, we have, well, in communication sciences and disorders, but I'm thinking specifically for myself as a speech therapist, and a lot of the students that we have, people come from all kind of language related loves into the field. So we have a lot of, students who came from like a musical theater background and had some voice treatment and were fascinated by the career. We have people who were foreign language learners and had a bachelor's in Spanish, or maybe they were working as an interpreter in the field for ASL, or had a parent who had a stroke. And so people come to it in such very different ways that we have a lot of linguists who, that's the humanities side. And Jonathan, I'm going to throw you in there as a linguist. So I really see you that way. So, right, we have people who study linguistics in that way. And then we have people who study linguistics and have a clinical expertise that want to also help people with delay and disorder. And then people who are exclusively sort of medical disorder associated. So kind of runs the gamut in terms of how big picture and small picture you get.
Can I borrow the phrase language related loves going forward? I like that.
Yeah.
Levon, you had your hand up next.
Sure, Belle, that was outstanding. Typically when you think about physical therapy, a lot of folks think about the individual. We treat a patient one at a time in a singular environment, to address their goals and their needs. But as our scope of practice has evolved, so has our involvement in public health. And so being involved with the College of Public Health for this program has, been essential. To look at, physical therapists who are uniquely qualified to provide screenings for balance and for falls, to be involved in prevention and wellness initiatives, to work with the other disciplines to really make that environment welcoming for all individuals and for groups. I think it started with pain management for physical therapy and being involved with, the resolution of pain for patients so they weren't exposed to medications that, could potentially be harmful for them or addictive. And now it's moved into, being part of that healthcare team that's part of emergency preparedness. If COVID taught us anything, right? Yeah, you're part of that team for emergency preparedness, as well as for performance for the public. So, I feel like now our discipline has expanded so that we have that voice in the room, which is, I think, essential when you're working with others. You need to collaborate and be able to talk the same language, right? And so I think that would be something that a lot of students would consider when they're looking at which discipline they may want to focus on. We're very similar and we're very different, right? So you really have to find that passion and see exactly what you would like to do.
But Lavon, I really like the way you articulated that with respect to, you know, you have those discrete skills and you're working with the individual, but you're also part of that larger fabric. And I think, you know, back to something that Sydney said, you know, I'm trained as a clinical psychologist, but I've always worked in multidisciplinary teams. So I'm as comfortable being around medical professionals as I am being around other mental health professionals. And it seems very odd to me when you hear the opposite, the people who are siloed or stovepipe and they're not part of that larger discussion. So I really appreciate how you brought that point home to people. Jonathan, you had your hand up next.
Okay. Some of you just shared just beautifully. And in the past, with American Sign Language, a lot of people think that it's just on the hands or that it's just for interpreting, but that's not the case. There are many purposes for sign language. As a kid grows up, if they're deaf and they can't really access spoken language, right? It all ties back to access. And we mentioned access. And what that means is, at that point, they need to learn how to sign to do turn taking. And that really helps them develop. And if we're not for sign language, they would not be able to thrive. And then there are other considerations as well. With physical therapy, with nursing, you're going to have deaf patients in these medical settings. And what I've noticed is there are more and more nurses that are taking sign language to deal with these deaf patients in clinical settings. Now, the problem is, and there's a resource, but a lot of times people don't know what to do. So we provide that consultation, how to get an interpreter, for example, how to use video remote interpreting, to use that technology to provide interpreter. And we just really want to make sure that people get the information they need and they get the access they need. That's really first and foremost. But the goal is, as we work collaboratively, as you said, that's what I wanted to share.
Thanks. Dan, you had something to add too?
Yeah, taking it from the micro to the macro and thinking about the students that are on this call, I think it's important that once we recognize that athletes act as health role models, this fosters a culture of wellness that transcends athletic circles, right? Society itself is given an opportunity to realign some of its values, elevating health above mere aesthetics, which is so often promoted and perpetuated by social media, photoshopped imagery, things like this, and instead foster a collective understanding of the importance of strength and nutrition. And moreover, addressing athletes' comprehensive well-being and health support speaks, and folks were kind of touching on this, speaks to the broader mental health crisis afflicting some of our societies today. So athletes, almost as ambassadors of a balanced lifestyle, now are encouraging open dialogues about mental wellness that we hadn't had before, combating the stigma and forging paths to resilience. So in doing so, I think they contribute, the athletes do, to the destigmatization, if I said that right, of mental health struggles, and promote positive coping mechanisms which are essential for a healthier society.
Mm-hmm. Anne?
Yeah, it's been really neat to hear more about all the, like, everybody who's on this call. And as I think about athletic training and the macro and micro levels, I think what's really important for us as ATs is to see what's going on across the populations that we're working with. So if I'm in a high school and I'm seeing that the basketball team is getting a lot of meniscus injuries, hope that's really bad, first of all, but, you know, I want to take a look back and see, well, what's going on at the broader sense where I'm seeing a lot of these similar injuries in these teams, and then try to do a, you know, look at the teams or look at the school and see if there's some changes that we need to make to our prevention program to stop these things from happening. And a really important skill for all of us when it comes to that is being able to see if those interventions, whether on the individual level or on the team or population level, are effective. So that assessment piece, I think, is really important for everybody moving forward.
Mm-hmm. Sydney?
On the note of integrating mental health with physical needs and healthy lifestyle, this is something that occupational therapy does well, and our programs here at Temple have community partnerships with many different organizations, one being Special Olympics, that focuses on the development of programs for groups and individuals, as well as advocacy to be able to facilitate the types of educational experiences, intervention, and change that are really necessary to help athletes with any type of need to live a healthy lifestyle, but also to move forward into adult life with solid community skills. So OT here has a lot of these partnerships with our local community and some pretty phenomenal fieldwork coordinators.
So let me remind our audience that if you have questions or comments for the panel, feel free to put them either in the Q&A feature or in the chat, and I'll read them in a minute. While we wait for those to come in, I'm going to ask our panelists a two-part question. So some of you in your introductions talked about how you work primarily with graduate students and getting people ready for the workforce. But as you know, we have a lot of undergrads in the College of Public Health who are they're either undecided or they're studying health professions. And so they're kind of probably listening to this conversation and responding to different snippets here and there. So the two-part question is this. Reflecting on your own career trajectory and what brought you to this stage, when did you find your home? When did you find your discipline? And what words of wisdom would you have for the undergrads who are listening, who are hearing something and say, boy, you know what? Athletic training sounds really interesting, or PT sounds really interesting, or social work sounds really interesting. How do I go and get involved? Ashley?
Yeah. So one of the things that I think about in terms of advice is if and when at all possible, taking different courses that will allow you to get some insight. But if you're not able to take courses, you know, you're always welcome to come meet with faculty, read about what faculty are doing, researching and studying, look and see if there's any student organizations that you might be able to join that are associated with each of those. We have a social work student collective that undergraduate students can participate in and learn a little bit more about social work. We would welcome someone even and interested in the major to be part of that. But also, you know, stopping by any of the events in the school social work. We have the social service annex where you can meet other students, for example, and I'm sure there's some opportunities in other programs. And you know, when so my undergraduate degree was in something different than social work, and it was the moment that I went into my MSW program that it hit me that like, this is home, this is where I was supposed to be. It was the perfect unification of wanting to address mental health concerns within communities, and also looking at the systemic and structural factors that influence people's mental health. And so that was like the perfect mergence of those two topics for me in social work. And had I had the opportunity, I didn't know much about undergrad majors, particularly in social work, but had I known that, I would have been even more prepared to like go into that depth of study, or been able to go right into the field once completing my BSW and do this work. But I remember being an undergraduate student, and I took as many classes as I could. I took a lot of classes in the disciplines that are on this call, and I really enjoyed them all. And it really allowed me to kind of see, what am I really passionate about, or what could I do with any of these degrees that would get me to the next part of what I'm most passionate about doing. So I would really would encourage people to explore different courses if it's possible. And if that's not possible, go meet with faculty, participate in events with other students in those majors, and learn more about the field and what you could possibly do. Allow that excitement to lead you in exploring the possibilities. And then I'll pass it on to Anne.
Yeah, that's great. Thanks, Ashley. And you reminded me, by saying, popping into other events. When I was talking with my students about, this session on Friday, they're like, well, how do I register? And I said, well, you go to the CPH website and there's a calendar. And I don't think they and when, if you go to the CPH calendar, you see all the events from across the college, all of the student groups, all of the other things. And so I agree with you completely. Going to those events and to put your toe in the water, if you will, is a great way to see, is this in fact my potential academic home? So, Ann Doloff.
Oh, just to piggyback on that, Ashley, that was great. It was really try to take those intro classes that will help you look at all the options. Like we have 2 in recreational therapy that really, by the time you take one of those 2 courses, you'll know whether it's for you or not. I mean, we guarantee that. Like you'll either get excited or you'll be like, yeah, this isn't really what I want to do. So definitely do that. I love reaching out to faculty. We all get very excited talking about our professions and what has led us to where we are, but also capitalize on advisors. Go in and sit down with advising at the undergraduate level. And even if you go in and say, I don't know what I want to do, they'll start talking to you about, what do you like to do? What are your strengths? Do you like working with people? Do you like writing? Are you comfortable talking in public? You'll start looking at those things that you might already be really good at. I mean, I was a Greek and Latin major as an undergrad. It made my grandmother really happy. She was a high school Latin teacher. Anyway, more than you need to know. And I was bored to tears. And I took an adapted aquatics course. And I literally had that faculty member just sort of pull me aside and say, you're really good at this. You need to think about this field called recreational therapy. That's all it was that completely changed my life. So connecting with us and taking those classes and finding those experiences can lead you in a direction that, you don't get a degree in Latin and Greek.
That's great, Ann. Thanks for sharing that. Monica?
Yeah, I definitely agree with the sentiments of others that have spoken. Meet with faculty members who are in those areas and really try to dive into what they have to talk about and where their experiences are. Learn more about the profession. Ask questions, take some of those intro courses. We have an intro course in exercise science for students to take. It really gives you a good idea of what the major is about, what you're going to look for, what your job expectations are. Also think about shadowing and going out and really experiencing the profession if you're able to go and spend a day following someone around to really see what it's like hands-on. I think this was a common theme from the others who've spoken. I didn't know where I wanted to be and what space I wanted to be in until I took a cardiovascular pathophys course. And then I was like, oh, I love this. This is where I want to be. I want to work clinically. But I was also a college athlete and always wanted to work with athletes too. So I was able to kind of meld both aspects together. And it's really about figuring out where your space is and what you fit best in.
Yeah, for those of you who are monitoring the chat, several people have echoed this idea of shadowing and going and following faculty members and seeing what they do. And Fel Garcia highlighted that this semester there's actually a rec therapy and speech therapy co-treatment program existing. And I can tell you, and I'm sure others will echo with this, some of the most exciting moments you have as a healthcare provider is when you are working on a clinical issue or a program issue with a multidisciplinary team, and you're all working together effectively from your different perspectives. I mean, early in my career, those were some of the most rewarding days that I had, where you would be with other colleagues and learning it. Wow, this is the role the geneticists play. This is what the surgeons do. This is what the speech and language pathologists do. And it's a great, great way to see, A, is it a good fit for you, but also to get caught up in that enthusiasm that you're hearing from so many panelists on our meeting today. Levon?
Yes, I did not want to put my hand down, but Monica, I totally agree. We send our students for shadowing, anyone who's interested. And physical therapy is such a welcoming profession. Literally your corner PT, office or a hospital, and you reach out to them and say, I'd really like to shadow and, find out more about this discipline. One thing is if you do go to a hospital or medical center, you may have the opportunity to shadow multiple disciplines. And so that would expand your horizons as well. And as for me, I had an eclectic background. I was an athlete. I also loved physics. I loved biomechanics, and I had never heard of physical therapy. So this was multiple decades ago, so we won't say when, but I literally went to a library and started looking up these things. And I'm like, what is physical therapy? Next day, I started looking for places to shadow, and I've been in this profession ever since. So you never know where you're going to find that impetus to get into the profession. But once I started getting into the clinic and working with the therapist, I knew that was what I wanted to do.
Cindy?
So my pathway to OT was unique and not traditional, much like Levon and Anne shared. I was a dance major undergraduate. My goal in life was to teach dance to small children. Reflecting back, I realized I wanted to do that because in teaching dance, I helped children who were under-resourced and didn't have access to a lot of opportunity, a chance to connect and a place for community. So it all ended up coming together. But as I mentioned in the beginning, I have a family member who sustained a brain injury when I was going into my sophomore year of college. I didn't even know the words brain injury before that. And we were absolutely devastated when that happened. And it was a unique experience that really created impact for me because it was my dad, and he was discharged from the acute care hospital with no rehabilitation. It was an insurance issue. So we had a 2-week period at home where he had no speech, no ability to sit up, feed himself, use the bathroom, where we kind of had to figure things out. And I was so frustrated with the medical professionals and the system. Fast forward, really quick version, someone wrote for a grant for him and he was permitted a rehabilitation stay. And when we arrived on the first day, many rehab professionals, medical professionals came in, but one woman who came in not only spoke to him, but really seemed to convey a language that with aphasia he could understand. His communication was impaired by the brain injury, but also turned around and immediately addressed every issue with the physician in such an impressive way. And she also had him doing things like actually moving and approaching activity by the end of her one evaluation session. So when she was done, I followed her into the hallway and said, what is your name? What is the name of what you do? I need to be that. And then I hustled back to college that fall and they changed my major. And I've never been unsatisfied about that. Our program here at Temple also offers opportunities to shadow. We have a very community-focused curriculum, so we have lots of connections out there to get out there and see what OT is doing. We also run a lot of different special events that undergraduate students can attend. And have to plug this, there's one coming up on October 2nd. It's a Monday. I keep saying the wrong date. It is a Monday from 3 to 5 in the afternoon in the Star Building. And we are teaching people how to switch adapt toys. So there are new donated toys. They are often have tiny little switches. And how fun is that for a child with any type of physical impairment? To not be able to turn that on. So we will provide you with materials to adapt those toys. And then we donate them in the local community in time for the holidays.
Thanks, Cindy. So before we get to a couple of our other panelists have their hands up, but a couple things I just want to say. One, for those of you who are in the audience, please be sure to check out the chat. We've got several faculty members, several panelists who have given other great ideas about shadowing. They provided some of their contact information. And several of them have also talked about their journeys to their profession. And, while Dr. Abbott Gaffney just talked with us about, how her journey was very personal because of what happened in her family, we've got other people who, were undergraduate majors in very different disciplines and very different areas. And we've heard that. And so I think it's really important for the students listening to realize that there are many different roads that lead us to the things that we love and that we're passionate about, and that it doesn't always happen the day that you graduate from college. It may not, maybe it's your junior, maybe it's your senior, maybe it's a year or two later. But please do check out the chat if you're hearing things that are really resonating with you. But let me go back to our panelists and Jennifer Brown.
Thank you for sharing. Thank you. I just wanted to share, especially for someone who might not have no idea of what they want to do, that it really is important to just follow your passion, and sometimes it will just take you where you need to be. For myself, I had no interest in becoming a nurse. I wanted to be an in-flight stewardess, and then with plans to go into aviation. I did that for a while and then went into business, teaching, and ultimately nursing, and found my niche. But the thing with nursing is that there's such a wide variety and scope for persons to change their minds about the direction that they think their life may be taking them. We have so many opportunities in nursing for students to go into the clinical area and shadow different types of nurses, but also to provide students who are in a high school setting. And most of the high schools nowadays, they have added to their curriculum opportunities for students to shadow. So going in and shadow those persons, whether it's in a healthcare setting or in the classroom or in a school, being a school nurse, there are all these opportunities. But what we have started doing is to create that pathway so that we go into the schools and provide students education about the profession of nursing and let them see all the opportunities that exist and give them a chance to really explore that. And that, I think, is one of the main ways that we can reach back and help them, because not every child will have the opportunity to shadow someone or know someone that they can go out and go to work with. So us taking it to them, I think, is a great place to start and make it more equitable for all students to be given the opportunities to explore and see where their passions might take them.
And Jen, I'm so thrilled that you talked about the diversity of what nurses do, because I think for all of us, we have our cognitive script. So somebody says nurse, and whether it's because of what we watch on television or if we know a nurse, we think we know what they do. And we think it's in this kind of discrete box. And the reality is, with so many of our professions, they can go in so many connected yet differential pathways that we oftentimes don't know about until we're actually in the field ourselves. So I'm really thrilled that you said that. Jonathan?
I just wanted to add to that. Just to let you know, I've really enjoyed listening to everything that you've shared today. It's been amazing. But I think one important thing that I can share is to really follow your heart. I can remember back in high school, I was at a school for the deaf, and one of my teachers saw the potential in me, but I discounted it. And there were hearing parents that were being taught, and I enjoyed doing that, teaching hearing parents with deaf kids. But then I didn't really want to become a teacher. I was really curious about other things in the discipline, even though my heart was originally there. And unfortunately, I had so many different majors in college. I really bounced around to a lot of different disciplines. And I was a history major originally, and what are jobs for that? There are few and far between. And then a deaf school recruited me to work as a teacher, and I fell in love with it. And at that point, I found my passion. And then also teaching these hearing parents at night who were learning sign language. And once I followed my heart is where I really started to grow. And then just meeting with people that do physical therapy and interacting with them and then starting to instruct them. And then at one time, my son had to go to CHOP, to the hospital, and I did education there. The nurses, the doctors, the speech therapy, I grew up with speech therapy, but my whole life has been teaching. And that's really who I am. That's really my heart. And once I really pursued that, I knew I wanted to be an ASL teacher, that would be fulfilling for me. That's what I enjoy. And I put it off for so long, and then later became an ASL teacher, and that was it. That was my passion. It was a circuitous route, but I found my heart.
Jonathan, thank you so much for sharing that. That was
And I wish that for everybody here.
Yeah, that was incredibly inspiring to hear. And it's 5 minutes before 2, and I was tempted to ask another question, but frankly, I don't think we can end on a more positive note than that. And for those of you students who are listening, I really hope that you appreciate what a great gift you just received from our faculty. You often see us in the front of the classroom. You often may be intimidated to come and talk to us or ask us about our individual journeys to how we became who we are and what we do professionally. And, my colleagues on the faculty did just such an exceptional job today of sharing, their personal passions and their interests and their own journeys that led them to where they are today. And I really hope that you all are as inspired by what you heard as I am right now. And I hope that you find that passion yourself, regardless of what that discipline is, and that you follow what's in your heart, as Jonathan just said. But let me the sincerest of thanks to my colleagues who were volunteered their time to be on this panel today. As I said at the beginning, we were so thrilled with how last week went. You guys knocked it out of the park this week. So this was absolutely wonderful and such a great gift to our students and our community. So I thank you all very much. And I hope the rest of you take as much from this as I think we are all taking from listening to one another a little bit as well. Next week, we are doing something else a little bit different. We are going to do a grand round session where actually some of our colleagues from the Center for Obesity Research and Education are going to talk about some of the really cutting edge and impactful work that they're doing in working with moms on healthy feeding and eating behaviors for young children, as well as interventions for children and adolescents who are at risk for developing obesity. But again, the deepest of thanks to my faculty colleagues for really bringing their A game on this Friday afternoon. And I look forward to seeing you all in next week's session. Take care, everyone.